Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on VHHA.com and on popular podcast hosting apps including Apple Podcast, Amazon, Spotify, and many others. We're a member of the Public Health Podcast Network, Virginia Audio Collective, and the World Podcast Network. Podcast episodes also air Sundays at noon on 100.5 FM, 92.7 FM, and 8:20 a.m. across Central Virginia, 1650 a.m. in Hampton Roads, 105.1 FM, and 1050 a.m. in Lynchburg, and Wednesdays at 1 p.m. on 93.9 FM in Richmond. Please send questions, comments, feedback, or guest suggestions to pcfpodcast@vhha.com. That's pcfpodcast@vhha.com. Today we're pleased to be joined by Dr. Sivabalaji, Kaliamurthy, Director of the Addiction Program at Children's National Hospital, for a conversation about his work, addiction treatment, programs for adolescents, combating fentanyl addiction among young people, and more. With that, welcome to the show. Thanks for being with us.
Thanks for having me, Selena.
It's our practice to start these conversations by getting to know our guest a bit more. What we know about you is that you are a board-certified physician in general psychiatry, child and adolescent psychiatry, and addiction psychiatry. You work with both Children's National Hospital and Howard University, serve as a faculty member at both George Washington University and Yale University, and you work with local school districts and health departments' substance use prevention among children and adolescents. I imagine those professional details only scratch the surface of who you are. So beyond that, what are some other things people should know about you and your unique personal story?
I've never been asked that question. I usually start out with what you just used to describe me. So I am also board certified in addiction medicine, which is specialty under the American Board of Preventive Medicine, to add on to the other certifications. So what I really want people to know is that I'm very passionate about preventing the consequences of substance use disorders, both for the individual who struggles with it, but also their families and community at large. And it's often a difficult path towards getting the necessary training required to enter this field, which is due to the extent or the length of the training involved, and which requires people to forego, independent practice for another year or two to get the board certifications. And I was in a place of privilege where I could stay in training for longer and be equipped with the training required to help this vulnerable population. And the way I came about pursuing these specialties was that very early on in my psychiatry residency training, when I was working with people struggling with a substance use disorder. Most of them shared their stories about starting using substances when they were about 13 or 14, which also is caught by the data that we see where 80% of adults who struggle with an addiction started using substances prior to age 18. And one of the interesting caveats in the stories from these patients was that even though they started using substances so early on, nobody really spoke to them about the use of these substances. Nobody screened them, and they did not know that they could get medical help until quite late into their struggles with the substance use. And I was able to kind of combine my passion for working with children and understanding where many of the adults with substance use were coming from to kind of try to figure out ways in which we can intervene early on.
Thank you so much for sharing that. And that ties into our next question. So, as a baseline for this conversation about substance abuse treatment, it's helpful to provide some context for listeners about the opioid crisis, which evolved out of increased prescribing of opioid pain relievers over the past few decades. This led to misuse of prescription and non-prescription opioids that have the potential to be highly addictive. In 2017, the federal government declared the opioid crisis a public health emergency, and a range of legal, civil, and policy actions have been taken on the federal and state levels to combat this trend. Today, statistics show thousands of U.S. deaths each year are attributable to drug overdose, many of which are associated with opioid misuse. Among adolescents, a New England Journal of Medicine study found that an average of 22 adolescents died from a drug overdose each week in 2022. Fentanyl is a synthetic opioid considered more powerful than morphine and heroin. It is cited as the leading cause of U.S. deaths in the 18 to 45 age range, and fentanyl poisoning claims 175 lives each day. With that background, can you share a brief overview of your observations about the opioid crisis and fentanyl and the danger they pose, especially for young people?
Let me start off with the trend here. So historically, when we look at adults who struggle with opioid use and who've experienced overdoses or died from overdose or poisoning, a lot of them started using opioids because it was prescribed to them following a procedure or for other purposes like chronic pain. But for adolescents that are seeking treatment right now, especially in the last 2-3 years, this may not be true. And for most of them, it is not. For most of them, what we are noticing is that their first entry into opioid use of any kind seems to be these fake M30 pills. They look blue. They're made to look similar to the ones you would get in the pharmacy, and they don't have any opioids in them other than fentanyl. So there has been a shift in how adolescents specifically are getting access to opioids and the kind of opioids they're exposed to, which is kind of scary when we think about it, that the first opioid of any kind that many of these adolescents are using is fentanyl. And we don't know the long-term consequences of the adolescent's exposure to fentanyl at this time. Historic studies on adolescent opioid use have always focused on prescription opioids, which often had less potent opioids in them. So I think the reason I'm bringing this up is because we have to also identify the challenges that adolescents face might be unique to them and very different from adults with opioid use disorder. And as a system, we have to understand that and try to meet them where they are, understanding that this is a chronic disease and we have to try our best to engage them in treatment.
So, substance use disorder is a treatable mental disorder that affects a person's brain and behavior, leading to their inability to control their use of substances like legal or illegal drugs, alcohol, or medications. Part of your work focuses on early intervention strategies in substance use prevention. Can you expand on what those early intervention strategies look like and ways in which they can help young people?
So, in terms of early intervention strategies, I think we have to continue our focus on educating our adolescents, our high school kids and middle school kids, and we need to have an emphasis on early intervention. What we are noticing now is due to the combination of early exposure to information around drugs and having access to social media, which may also mean access to the substance itself becoming easier, we need to have these conversations early on. So oftentimes parents and physicians and healthcare providers might leave these conversations for too late or when the kids enter high school. But these are conversations we should start early in middle school, 6th grade, and in some cases even by the time the kids are in 5th grade. The earlier, the better. And we specifically want to arm kids with accurate information, which is important because we know that we can't always control them 100% of the time, but adolescents are known to make the right decision when they're armed with the right information. So a lot of our prevention efforts should be focused around arming our kids with the right information, but also otherwise creating an environment for them to thrive in, because adolescence is a period of high-risk behaviors, which is part of how they learn and grow, but we don't want any high-risk behaviors that they may engage in having lifelong consequences. So most of our prevention work is based on kind of making sure that they are armed with the right information to make the best decisions for themselves, and also what are ways in which we can create a safe environment for them.
Thank you for sharing that. And as I understand it, Children's National Hospital has a unique addiction disorder program that caters specifically to young people. The program provides treatment services for children and youth at risk for substance use disorders and other types of addiction. Some of its patient successes have even been profiled nationally on CNN. If you would, tell us more about the program and its treatment regimen.
Thank you. So the Children's National Addiction Program, it was established in January of 2022. And what we are is called a Level 1 ASAM outpatient clinic. So the American Society for Addiction Medicine has categorized treatment centers into different levels based on the intensity of the treatment services offered. And what we do is we are an outpatient clinic where kids and parents present because they have identified problems with substances already. And we are able to assess and provide a diagnosis at the time of the assessment and figure out the next steps in terms of treatments that the kids require. And one of the advantages of our clinic is that it is within our department of psychiatry. So we are able to manage the substance use disorder or the addiction itself, and also any co-occurring psychiatric illnesses, which may be a risk factor for the child. And since January of 2022, we've had an impact within the hospital system. We have increased the number of screenings that we offer. We have been able to get more patients from our emergency room to our outpatient clinics. We have been able to get patients who are admitted, the kids who are admitted to our inpatient unit, either to psychiatry or to other disciplines within the hospital, then transition successfully to outpatient follow-up. One of the key features of our clinic is that we don't, it's not an intense program, it's an ongoing treatment program, considering that addictions are chronic illnesses, and we wanted these kids to have a place where they can continue coming back for regular treatment instead of focusing on just acute intensive treatment aspect and then going back to their regular lives. But we wanted to capture them and try to retain them in treatment for as long as we can, because given the chronicity of substance use disorders and addiction, we know that engagement in treatment long term is really what helps them change their developmental trajectory.
And then big picture, I think it's fair to say that Americans have been exposed to a wide range of drug prevention and anti-drug abuse public education and awareness messaging over the years. Unfortunately, substance abuse continues to be a public health issue that we contend with. For people listening to this, whether parents, educators, clinicians, or others, what advice would you offer about supporting and engaging young people who may be struggling with substance use?
So overall, what we have learned from collecting data among practices around substance use in kids in middle school and high school is that if we take a look at the last 30 years of data, the number of kids who are experimenting with drugs has definitely come down. But and this has been attributed to all the positive messaging and education that we have been doing within our school systems. But what we are noticing is that among the kids who are reporting experimentation or using substances, more of them are daily users than before, and more of them then have problems related with their substance use. And the big reason for this is the substance they're using itself. The potencies have changed dramatically over the last decade. And this is true for nicotine. It used to be cigarettes before. It's e-cigarettes and vapes now. It's true for marijuana or cannabis. The potency of the products have definitely gone up, right? And if you take every other substance out there, including opioids, which often is fentanyl for the kids, the potency has significantly gone up. So what we do know is that if kids are using substances, they would definitely benefit from medical evaluation. The reason I'm saying that is because many times when parents do come to know about their kids' substance use, the expectation for having the kids stop on their own can be quite high. But unfortunately, many of the kids may not be in a position where they're able to do that successfully without going through withdrawal symptoms and cravings. And, being able to have a medical evaluation to assess for the extent of the problem and the likelihood that the kid may or may not go through, withdrawals and cravings will really help the parent and the child successfully stop using substances. That would be a huge takeaway for parents listening in terms of expectations around their kids when they do find out that they have experimented with substances, trying to figure out the extent of the substance use and having a medical evaluation when possible to figure out if they need additional help to stop.
Thank you so much again for being with us today, Dr. Kaliamurthy. Before we let you go, we do have our tradition on the Patients Come First podcast to ask our guests a pair of fun, personal questions. To keep things interesting, we have a list of 10 mystery questions. So why don't you choose two numbers between 1 and 10, and I'll ask you the corresponding questions.
I'll take 5 and 7.
Sure. Number 5, if you could spend the day with one person from history, living or otherwise, who would it be and why?
I would say right now I would really love to spend some time with our Surgeon General, Dr. Kaliamurthy. I am currently reading the book he wrote during the pandemic about loneliness and the different factors that contribute to it and how that can pin together many of the societal and medical issues that we are seeing in life right now. And I really can relate to some of the concepts he's talking about there. So I would think that's the first name that comes to my mind right now.
And And number 7, if you could choose one superpower to have or any one skill to instantly master, what would it be and why?
Superpower. That's a good one. Accelerating the rate. I don't know. This is not a superpower, but if I could figure out ways to make changes faster, in whether it's policy, whether it's building systems, whether it is creating new interventions that will be helpful to kids, kind of like the Flash. So the Flash travels at light speeds, but I was like, if I could have a superpower to make things happen quickly, that would be something that I would really love to have, or even just like learn the skill to make things happen faster.
I love that answer. I think that's great. And that will bring us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so you know when new episodes are released. And we want to once again thank our guests for joining us today. So thank you.
Thank you, Selena. Thanks for having me.